Hey guys, it's Dr. Rian Maercks here, and we've been getting a lot of questions about what we call the hybrid Maercks vol lift. So it's a combination of different things, and basically what it boils down to is a very specialized technique I've developed to get a zero downtime, zero pain facelift for most people. Now that gets combined with different techniques depending on needs, and depending on patient's needs and expectations, I combine some other more advanced techniques, or I wouldn't say more advanced, but different techniques that add to recovery. So let's take you through a few different patients and give you an idea of what we're actually doing when we post these radical transformations and we tell you no pain, no recovery, no downtime. Here we go. Okay, so this patient is really a Maercks microlift patient. So this is a procedure that I designed for people who can tolerate zero downtime. That means you're gonna come and you're gonna go out and your life is normal. You go out to dinner with your friends that night, really zero downtime. This patient is young, early 30s, typically not a facelift patient, but everyone, even late 20s, early 30s, is concerned about this these days, probably because of all the time we spend on our phone, video calling and stuff. But you see here, there's some skin, there's some laxity up there, a little bit of pooch there, and there's no definition of her jawline. So here in a 1 hour procedure that can be done awake or asleep, the Maercks microlift, we're able to give her that jawline contouring, that tight neck, and a really rejuvenated, more youthful appearance. So that's the microlift alone. By minimizing the dissection, a technique a concept I call histiocentricity. I established that concept about a decade and a half ago. We do minimal dissection, really focused maneuvers to really just do what we need to do. And amazingly, there truly is zero downtime, zero pain, go about your life. So this opens the doors to neck lifting to patients that can't tolerate it, don't really want surgery, don't want a facelift, don't need general anesthesia, can just do it awake in an hour. So that's the microlift. Patient number 2 is also a Maercks microlift. This is a really no downtime, quick recovery, radical result, a little bit older patient. This is a patient that really could do a facelift, but did not want a facelift. Said no facelift, no surgery, no anesthesia, no downtime. So again, we delivered this result with zero downtime and no scars, no pain, beautiful result. And so that's the straightforward microlift. This next patient is actually a revision facelift. Believe it or not, she paid for a facelift and got this result. Pretty disappointing. She already had the scars all the way around. So this is kind of a modification of the microlift. I really just did a microlift because she didn't want downtime. She didn't want something complex. We didn't do anything to her face proper. Just her neck, the submandibular area, and really the lower third of her face is what the microlift addresses. But you see in this revision facelift technique, looks beautiful, night and day difference with a no downtime, quick recovery. We did this completely awake. We did, since you already had those scars, we used an extended scar because they were already there. Otherwise, with microlift, we do not make a scar in front of the ears. It was there, so we used it and made the scar nicer. This is an older patient that's had multiple procedures before, really should have a facelift. But again, I achieved what she wanted, a cleaned up neckline, and we got the redundancies and weirdness here, gave her a nice straight jawline. And again, a 1 hour procedure does not require general anesthesia. Just get in there, focus dissection, focus technique, microlift, beautiful result, and straight back at it. Out to dinner that night with her friends like nothing happened. This patient's super interesting because, again, we did the Maercks microlift, but people with a retrusive chin have a unique opportunity. We combined the microlift with a genioplasty, where I cut the bone and slide the bone forward, and look at this cleaned up neckline. She starts out with really no chin, no neckline. Even if I made that really snatched tight with microlift, it would be a little underwhelming, but throwing her chin bone forward gives her a much nicer profile, and wow, look at the difference in everything from her neck down here to the jawline, how that sticks out. So each different patient, depending on expectations, desires, and physical findings, retrognathic or short chin is a really big opportunity because they get to pull with the microlift back this way, and the bone pulls the muscles that way. So we have a bidirectional pull and really get that tight, beautiful neckline. This patient's super cool. It's just like the patient before. We did the Maercks microlift, combined it with a genioplasty, pushing out the chin, but also since his muscles here have at a very obtuse angle, even with those two procedures, although get tight, he wouldn't have that flat, high jawline. So what do? We added in a submental lift. That means a small incision here where we go in, we open the platysmal muscle, we remove fat that's behind the platysmal muscle, pushing this down. We go into digastrics, another pair of muscles up there, tighten those up and tighten up the platysmal muscle so it goes, sucks up in there, and wow, look at that result. We got the chin out, we got a neckline. He didn't even know he had an Adam's apple. Now he has an Adam's apple. And look at how that jaw contouring goes all the way up. Really amazing. And that's because of the Maercks microlift going in there and getting that platysma to really redrape, pushing the bone forward, and then putting those muscles back up. Three things. So the idea here is that what we do at the Maercks Institute is design bespoke procedures that are fitted to the patient, their needs, their physical findings, how much downtime they can afford and what they want. But we have all the tools. Anyone that says that one facelift fits everyone, probably not correct. My most generically applicable facelift is really the Maercks microlift because it addresses what everyone wants with no downtime, no pain, pretty much no planning, and get about their life. So if you're interested in any of these techniques or consultation, give us a call or hit us up here. Thanks for listening.